Hello, this is Dr. Ross, and this is the second presentation on vascular anatomy for Anatomy and Physiology 2. All right, so let's begin this second presentation by examining the arteries of the abdomen. Not all of these are paired, so I've indicated the ones that are. The arteries in this image will ultimately arise from the abdominal aorta, so let's start by labeling that. All right, so the celiac trunk is a major artery that supplies the gastrointestinal tract, and it gives off three major branches. I apologize that this image isn't great for these, but you can kind of see them sticking off. So this celiac trunk is going to branch into the left gastric artery, and ultimately that will supply the distal esophagus and part of the stomach. It will also give a branch called the common hepatic artery. This is a short blood vessel that will supply the liver, the pylorus of the stomach, the duodenum, the pancreas, and the gallbladder with oxygenated blood. And then the third branch is the splenic artery, and it will supply blood to the spleen. So next is the superior mesenteric artery. The superior mesenteric artery is non-paired, and it's a major visceral artery. So it supplies blood to much of the viscera of the abdomen. The inferior mesenteric artery is below. It's also a non-paired artery, also supplying oxygenated blood to the gut. Next, we have the renal arteries. These are paired arteries that supply the kidneys with blood. So now if you have narrowing of one or both of these arteries, that can actually lead to hypertension. And that's because the kidneys will be affected. When they sense that decrease in blood flow, they will release renin. This will ultimately increase blood pressure to preserve perfusion to the kidneys. Next is the gonadal arteries. These are paired primary arteries, and it's the primary vascular supply to the ovaries in the female and the testes in the male. Then you have the common iliac artery, also paired. This originates from the aortic bifurcation. So the aorta splits into the left and right common iliac artery, and then those in turn will bifurcate into the internal and external iliac arteries. The external iliac artery will provide the main blood supply to the legs. The internal iliac artery and along with its branches, will supply the walls and viscera of the pelvis, the buttocks, the reproductive organs, and some parts of the thigh, as well as the urinary bladder with oxygenated blood. Right, moving down to the lower limb. So from the external iliac artery, the blood moves to the femoral artery, also known as the common femoral artery. The femoral is the direct continuation of the external iliac artery, and it constitutes the major blood supply to the lower limb. It continues on as the popliteal artery, which carries blood further down the limb. The popliteal artery then splits into the anterior and posterior tibial arteries. The anterior tibial artery is the main blood supply for the anterior compartment of the leg. The posterior tibial artery supplies oxygenated blood to the tibia and calcaneus and a large number of leg muscles via some branches. Now, if I can turn your attention back to the top of the slide, I want to also note the deep femoral artery. The deep femoral artery is the largest branch of the femoral artery, and it's located within the thigh, and it supplies blood to the muscles and some of the skin from your thigh. Last is the descending genicular artery, another femoral branch. It's found in the anterior portion of the thigh, and it supplies blood to the knee joints before branching into the saphenous branch and articular branch. And then finally down to the lower limb, we're going to find the fibular artery, which is a branch of that posterior tibial artery I spoke about on the previous slide. It supplies the posterior and lateral compartments of the leg, and it descends along that medial side of the fibula. Continuing with the posterior view, we find the plantar arteries and the plantar arterial arch. This supplies the underside or sole of the foot with oxygenated blood. In the anterior view, we can see the dorsal pedis artery or pedis artery. This is going to carry oxygenated blood to the dorsal surface of the foot. It also serves as a reliable place for palpitation, and it's often examined by physicians when assessing whether a patient has peripheral vascular disease. This artery ultimately will terminate in the dorsal arch, which is shown here in this image that just popped up. So it's kind of that arching artery that goes across the middle of the foot. All right, so now I want to describe the return of the blood starting in the lower limb with the dorsal venous arch of the foot, which is shown here. It's usually fairly easy to see if the patient is barefoot. It will drain into the saphenous veins. So the small saphenous vein, or short or lesser saphenous vein, is a superficial vein of the leg. It drains the lateral surface of the leg and then runs up the posterior surface of the leg to drain into the popliteal vein. The femoral vein is a blood vessel that accompanies the femoral artery, and it is a continuation of the popliteal vein. And it continues on, eventually turning into the external iliac vein after leaving the thigh. Before we do that, let me discuss the great saphenous vein. This is a large superficial vein of the leg. It's the longest vein in the body, running along the length of the lower limb, and it returns blood from the foot, leg, and thigh. From the lower limb, we continue through to the abdomen where the blood will make its way back to the heart. So the external iliac vein or veins will drain the lower limbs. There's one on each side. I'm just labeling one. Recall that I just mentioned the femoral vein is going to become, or the external iliac vein is a continuation of the femoral vein. Each internal iliac vein, again, one on each side, will collect blood from the veins of the pelvic cavity as well as some of the gluteal region. And then the internal and external iliac veins are going to merge to form the left and right common iliac vein. The common iliac veins will unite to form the inferior vena cava. Okay, so both the internal common iliac veins are valveless. The external iliac vein, both the internal and common iliac veins are valveless. The external iliac vein may have a single valve. I just thought that was interesting. So other veins that drain into the inferior vena cava are going to include the renal veins that drain the kidney. They carry the blood that's been filtered by the kidney. You have the gonadal vein. It carries blood away from the testes or ovaries, and it's going to merge into that renal artery before the renal artery drains into the inferior vena cava. You can kind of see that if you follow this gonadal vein upwards. Finally, the hepatic vein, which is going to drain the deoxygenated blood from the liver. This is also blood that's been detoxified by the liver. It's going to move into the inferior vena cava. And of course, ultimately, the inferior vena cava will drain into the atrium. So before I end this presentation, I have a couple more things to discuss. So this is as good a time as any to go through the portal system. The portal system is a series of veins that carries blood from capillaries of the stomach, intestines, spleen, and pancreas to capillaries in the liver. And so this is part of the body's filtration system. Its main function is to deliver the deoxygenated blood to the liver to be detoxified further before that blood returns to the heart. So it's going to include the splenic vein, which is a blood vessel that drains blood from the spleen, as well as the stomach fundus and part of the pancreas. You also have the left gastric vein. That's going to carry deoxygenated blood from tributaries draining both surfaces of the stomach. There's also the superior mesenteric vein. This is going to drain blood from the small intestines, basically the jejunum and the ileum. And its termination is behind the neck of the pancreas. The superior mesenteric vein combines with the splenic vein to form that hepatic portal vein, which I'll indicate in a second. The inferior mesenteric vein drains away from the descending colon, rectum, and sigmoid, which are all parts of the large intestine. So ultimately, all these veins will drain into the portal vein or hepatic portal vein, and then this blood vessel will carry the blood from the GI, gallbladder, pancreas, spleen, etc., to the liver, where it will be detoxified. And then it's going to leave the liver through that hepatic vein, which I just discussed in the previous image. So the last thing I'm going to go over is the pulmonary circuit, which you've already heard quite a bit about, so I'm just going to reinforce it here. So the pulmonary circuit is comprised of the veins and arteries through which blood flows to and from the lungs and heart. So the deoxygenated blood leaves the lungs through the pulmonary trunk, which is not shown in this image. It's blocked. And then from the pulmonary trunk, it's going to move into the left and right pulmonary arteries. I'm just labeling the left one here. So I want to note here that although the pulmonary arteries are carrying deoxygenated blood, the blood is traveling away from the heart. So these are arteries. Arteries take blood away from the heart. So these are going to further branch into, both sides will further branch into the superior and inferior pulmonary arteries. Once the blood's oxygenated in the capillaries in the lungs, it's going to make its way back to the heart through the superior and inferior pulmonary veins. Again, although the blood is oxygenated, it's moving toward the heart, so these are veins. These will ultimately merge to form the left and right pulmonary veins, and then those are going to enter the heart through the atrium. And with that, I will end this presentation. Thank you.